Well, some exciting news from the medical world now. Birth control may soon be offered over the counter. We spoke with Dr. Kohli to hear her take on this new development. All right, Dr. Kohli, some big news for the medical world and for those out there who are looking to talk about contraception, birth control, all of that. These birth control pills may be going over the counter this summer, which is huge. Can you tell us more about this?
I mean, this is incredible.
Yeah.
Quite a shift, right?
Yeah.
And I think a lot of what has prompted this is giving people reproductive rights back, especially with Roe v. Wade and all of the, controversy that's happened over that. So the idea here is to really help people, knowing that there's a big burden of unwanted pregnancies, to help people sort of get control back of their reproductive health. So if birth control pills were to go over the counter, this would be the first birth control pill ever in the United States to be available over the counter. And very much of a game changer in terms of how we even think about empowering patients to take care of themselves. So as a cardiologist, one of the biggest medicines we use are cholesterol medicine, statins.
Yes.
And a lot of us believe that they should go over the counter.
Yes.
Because that's the way you're going to improve access, that's the way you're going to improve cost, and that's the way that you're really going to improve uptake.
Yes, definitely. Well, this is, again, like you said, so big for so many people out there. What are the benefits of making the pill over the counter, and what is your reaction to this? I mean, it sounds like you're pretty happy about it.
I'm excited, but I will give a little grain of salt, which is that we have to educate people to use it correctly.
Yes.
Because the more you start to put medicines out there, and I'm even talking Benadryl and Tylenol and Advil, and all of those medicines can have risks.
Yeah.
And so people have the perception that if something's over the counter, that it's probably safe, and they can take it in any way that they want. And when you're talking about hormones, you have to be particularly careful because some of them can be associated with risks for other things, blood clots and cancer and cardiovascular disease and such. So I think education to me is going to be the biggest and most important thing as we really move towards this. I like the idea of moving towards this. I think we do need to be careful, especially in our adolescence, because if you're talking about teenagers or college-going kids using some of these pills, they have to be taught how to use them correctly as well. Yeah. Otherwise, you're actually going to cause more harm than good because you may create more unwanted pregnancies where people have the perception that they're protected when they're actually not.
Right, that's very true. So this is something that we need to really be, aware of, educating our kids and ourselves about. Are there things that we need to be cognizant of if we're switching from one form of contraception to another?
The switching period is always the highest risk period. Okay. So if you're thinking about pregnancy risk and you're thinking potentially about, even kind of our physiologic changes that occur, there's so many different contraceptives out there in terms of the menu. There's the combination pill that has estrogen and progesterone. There's the progesterone-only pill, the O pill, that's what we're talking about here, that might go over the counter. Yes. There's the IUD, intrauterine devices, which are devices that go inside the uterus that, give off hormones as well. Then there's the depot shots, which are the progesterone injections that sort of sit under the skin and kind of give the birth control effects over several months. Right. So when you're going from one to the other, your body's going to feel different, your mind's going to feel different, and your risk for pregnancy may be the highest in the switching period, so you have to be a little careful. You also have to be careful about using other medicines that could potentially increase your risk. I always tell my young women smoking is an absolute no-no anyhow. Right. But if you're using any kind of hormone birth control pill and you combine that with smoking, you're talking about an exponential increase in your risks.
Oh my goodness. Okay, so obviously, a lot of people, I'm sure, who might see this become over the counter in the next few months here are going to think about potentially switching. So all things to keep in mind here. Of course, talk to your doctor and all of that. But we'll look forward to seeing if
an exciting development.
Yeah, developing
for sure.
this way. Thank you so much, Dr. Kohli.
Thank you so much.
Dr. Kohli, send us an email to MyCOCO at 9news.com and put Kohli in the subject line. Your topic may just end up on the show.